Good evening, colleagues. Thank you so much for taking time out and some family time to be with us this evening. So, who are we? We are SonoTech. We are a team of three currently with Dr. Fawzia, Hanli, and myself. We are SAPRA registered for the probe, and what we are trying to achieve is revolutionizing point of care ultrasound to ensure and enhance patient care. So, welcome to SonoTech Ultrasound South Africa. We are your trusted source for high-performance ultrasound imaging in both medical as well as aesthetic practices. It doesn't matter what kind of healthcare professional you are. We are here to transform precision in both facial aesthetics, guided injections, vascular safety, and musculoskeletal assessments. So let's see where we all started from. Yeah. So as we all know, this is the books that we get to study with the most beautiful anatomy on it. And unfortunately, this is not what our patients look like. Our patients sometimes look like the little green man on the right hand side. And this sometimes makes life very, very difficult for us. So, with beautiful anatomy, diagrams, and pictures that we have, and the ones that we get to study, this is obviously an indication of a patient's anatomy or anatomical features. But unfortunately, as we all know, it's not always a reality. Sometimes there's deviations, sometimes patients don't have certain muscles that they should have, or then an artery is really bifurcating somewhere where it shouldn't. Because, of course, as we know, each patient is an individual. How does ultrasound work? It uses high frequency sound waves, which then visualizes internal structures non invasively. So you can have real time imaging with your patient in your practice without you having to send them anywhere. Some of the features, it's very portable, it's lightweight, you can pop it into your pocket and off you go. Wireless connectivity, it connects to whichever device you've got, whether it's an Apple or an Android, your tablet or an iPad, giving you really great high resolution imaging with a friendly interface, which is quick to learn, not something that you need to worry about. And I'll speak about that a bit later. And it's battery operated. It has a lithium ion battery in it, which lasts anything between 1.5 to 2 hours, depending on your functionality you're using it for. And to recharge is between 20 and 30 minutes, depending on how many lines or bars you got left on your battery. Why would you incorporate soft tissue ultrasound into your practice? Got 5 points here: safety in injecting, diagnosing, management and prevention of complications, ensuring that the product that you are using, example of fillers, is correctly placed, then enhancing your treatment precision, as well as medical legal protection and prevention of ethical malpractice. I will speak about that a bit later as well, but that is something that you can use to add to your patient's notes. How will the ultrasound expand your diagnostic capabilities? Some of the areas that you can look at is vascular access, nerve blocks, if you're either an anesthetist or a pain doctor that is enhancing patients' outcomes, using it as an emergency setting as a point of care ultrasound, imaging of vascular structures, and then your soft tissue and MSK being your musculoskeletal imaging. This then for superficial structures as well as needle guidance. So what functions will you see? When we speak about a viewing device, we're talking about either your phone or a tablet or an iPad. So it doesn't matter whether you're Apple or an Android, it'll work on all of them. So some of the functions, GN on your screen will stand for gain. This is the contrast of your picture. Because we're talking about sound waves, it ranges between 32 decibels all the way up to 105, these are all adjustable. Your D standing for your depth. Your scanning maximum depth is up to 4 centimeters. This is then adjustable either swiping up and or down on your screen itself or then pressing the function for depth. Your next one is focus. There's a little arrow on the left hand side of the screen. And that shows where the linear beams emitted from the probe itself come closest in energy, almost like the rays of light that get bent on your eye lens to focus. This then depends on what you're looking at. Is it either superficial structures or is it something deeper down? This you can then adjust. Your DR standing for your dynamic range. This in where your GN or your gain is your contrast. This is now your brightness. This also ranges between 40 decibels all the way up to 110, which you can then adjust or change. Your F is your harmonic. This controls a frequency, anything between 16 and 20 megahertz. The higher the frequency, the lower the penetration. Your E and H is something called the denoise or the speckle. This filters the clutter from the returning echo. This then ranges between 0 and 4, and which this then softens and purifies your image. Next is the biopsy function. This is really amazing. So what is this? It enhances needle movement through tissue for either doing biopsies or locating a target for injecting. You've got two options, an in-plane or an out-plane mode. The in-plane is where you're coming from an angle and coming to either biopsy or then inject into an area. You get a dotted green line on your viewing device, which you can then track. The outplane mode is when you're coming in vertically, as obviously your needle is then perpendicular. You have got a line on your probe that will correlate exactly with that line going down. It'll also have, you'll see a bit later in the videos, it'll also have a round circle that you can then move around to ensure you exactly where you're wanting to inject. TGC is something interesting that you do not get on the smaller devices. It is your time gain compensation sliders that you have on your big stacks. This then controls the brightness in either the near or the far field of your viewer. Then to try and make life as easy as possible for you, we have got 11 different preset applications that when you click on any one of them, there's already parameters put in for you. Or then if you are in a busy practice, there are 3 customizable user settings where possibly you have an anesthetist that's doing a nerve block in your practice, or then a aesthetic injector that likes his particular parameters. That is all in there for you. So if I talk about 11 different preset applications, you'll see that a little bit later in one of the slides, but it's things like thyroid, MSK, which is your musculoskeletal, small parts, pediatric, vascular, blood flow. That is all in there for you already. Your save function, you can either save a screenshot of what you're looking at, or then you can have a video loop running in the background. So the video loop is something that you can preset. I will go through it a little bit more just now. And then your preset function, which is in your right lower corner, that is your settings to change things like your cine loop, which is your video loop, the time period for that, or then help for assistance with all your functionalities, as well as any app versions when upgrades get done. So what did I mean about the video loop or the cine loop? You have an option of recording any of the visuals that you're looking at, and this runs in the background. You have an option of recording from 100 frames, which is equivalent to about 10 seconds, to 1,000 frames, which is almost 100 seconds. This is continuous motion, which then obviously captures everything that you've just been looking at. This provides comprehensive documentation, which then obviously enhances your diagnostic accuracy. Why would you use it, or where would you use it? Always record a video loop before you are injecting an area. So if you're looking at aesthetics, if you are wanting to inject a nasolabial, before you start injecting, you are going to go and ensure that your vascular anatomy is as what you're wanting it to be. While you're injecting, if you're comfortable with doing that, that you can actually watch exactly what you're doing. You can see where your needle is and you can see where your placement of product is. And then again afterwards. This will then assess the patency and ensure that you've got absolutely no vascular compromise. Why is it important, or what are the benefits? It provides proof that your vascular patency is there post-injecting. If a patient returns to you with a little lump or swelling, that you can then look and evaluate, is it possible a bit of filler that's migrated, or is it a little cyst that's developed, or what actually is it? And this then enhances your clinical confidence and obviously then your medical legal protection. So here we can see exactly how you connect to your probe. Your probe talks to your device using Wi-Fi. When you put your device on the first time, it'll bring it up on your Wi-Fi options. You will click onto it, and the first time you use it, you will need to put in the serial number itself, which is on the back of the device and is specifically for your device itself. Thereafter, you can just go onto it and it should connect automatically. As I spoke about previously, there are 11 specialized preset functions and 3 customizable presets. If you look at the 2 options that it's showing, the one with the thyroid, that starts with the thyroid, that is for this specific device. The other one is for another device. So you'll see there's quite a range of options that you can then choose from. In this video, we've got the options of showing your pulse wave as well as your power Doppler imaging. So if you can remember, the pulse wave is the one where you can see the augmented signal at the bottom, and then your power Doppler imaging for your enhanced signal for any vascular that's either an occlusion or then just a low flow area. Another wonderful capability of this little unit is the fact that you can do measurements. If you've got an area of concern that's either a cyst, a granuloma, or if you're not sure if product has possibly moved, you can use this functionality. You will click on the measure and it gives you different options where you can look at either the circumference of it, you can even look at the depth, and if it is possibly a little tumorous growth that might be malignant and doesn't have nice even borders, you can then go and trace it using your fingers. This then obviously you can use then to bring your patient back in a month's time and do a comparative and see exactly what's happened. So on the screen, you can see it's to capture any details. So remember we spoke about both the taking almost like a screenshot or then the option of using it as a cine loop. So that is available to you. Previously, I spoke about the biopsy mode where you can use this for either needle guidance, making sure that you're coming in to a safe area, either with a cannula or with a needle, or then if you're literally wanting to take a biopsy, then you can use it for that. If you look at the pictures that you're seeing both your in plane as well as your out plane mode. Out plane coming in perpendicular. You can see these little lines coming down as well as a circle. The circle can then be moved. You can have a grid option, or then your clear is just to clear exactly what you're seeing there. Because this is a medical device and you are using it in a medical practice, all your pictures or images are captured in something called DICOM, and that stands for your digital imaging and communications in medicine. This you'll find in your x-ray units, wherever anybody's doing ultrasounds, your MRIs, they are all using the same thing. And I think what's really nice with us is that your storage comes without any subscription fees, and then our updates are automated. We do not lock you in within a year or 2 years where you have to start paying subscription costs afterwards or then pay for any upgrades. This is all included in the price. So we've spoken about your cine loops and we've spoken about your screenshots. This is not just important for your own records, but what if you've got an area of concern that you would like to share with one of your colleagues? This is available. you can click on a note and on your captured picture, and you can make as many comments as you would like. This is obviously quite beneficial if you are sending it to one of your colleagues and you are describing the areas of concern. Really nice option for you to have, or then you can put your notes on there and keep it for your own records. So we've spoken previously about the cine loop as well as a video loop. Just remember they are the same thing. You have got the option there. So if you can see under the settings, the first option is cine loop. It's currently always set or preset on 100, and there is your option to increase it, and you can increase it up to 1,000. One of the other things you'll notice on the screen is the wireless channel settings. The device itself will choose the best signal between the device and whatever viewing device you are using. You are welcome to go in there and change it if you feel the need to, but you shouldn't need to. The other thing that you'll see in there is also your DICOM settings. That is where you'll go in, you'll put your details in, you'll put the institution in, all those details will all go in there for you. Proven results in clinical settings. Are there studies available? Yes, absolutely. So I've got on this page and the next page that shows you that studies support the effectiveness of ultrasound guidance systems. I've just highlighted the topical points in there to show you that is it beneficial for your practice? Absolutely. Does it enhance patient treatment times? Yes, definitely. Does it assist with accuracy? Most definitely. This all then kind of goes back to patient safety, patient's comfort, and ensuring quicker time of treating your patients because you are going in and seeing exactly what you're doing. So ultimately, is this beneficial? Yes. These clinical trials are available to you if you do need them. You are very welcome to just let us know.